Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very exciting patient journey. My beautiful patient Lalita, she's from out of the state. She came to me at age 57 desiring facial rejuvenation, and her primary concerns were she no longer looked the way she felt, which is really the principal reason why everyone wants to do something to rejuvenate their appearance, because it's hard to live in a body that doesn't match your spirit and the way you envision yourself. And Lalita was no different. Her primary focus was her jawline and neck and the heaviness that had come from the overall descent of her tissues. If you can see her on her front view, you can see that her jawline and neck had become more square and heavy. There is bags being formed underneath the eyes, as well as extra skin above the eyelids. There's an overall loss of volume in the areas around the temples, the upper lids and the lower lids, and around the mouth. And when you take the overall picture and you look at it carefully, you see that she has changes that are primarily aging related, but again, in her mind and her eyes, she no longer even recognized herself. So when we look at these changes, we're going to address them systematically. The laxity that you see around her corners of her brow, her mid-face, and her jawline and her neck, all of that is going to be addressed with the vertical restore. It's going to bring everything back up. What I would do in that particular case also, and we can see this on the profile view, there's heaviness that exists in her submental or neck space. I would remove all that heaviness out using a direct neck approach, where I go in beneath the muscle and remove the fat pads, tighten up the muscles, sculpt the neck, and give the overall appearance of the neck a much more slender and more youthful look. Then we're going to lift the platysma muscle all the way up as part of the vertical restore, bringing everything up. The midface is going to be released and brought up so that it creates a less deep nasolabial fold, and that is going to be carried all the way up to the outer sections of the brows, where you get a lateral brow lift and create a more open eye. Then looking centrally, what we're going to do is look at the upper and lower eyelids, and as you can see, there's skin excess and tissue excess, in addition to volume loss. So I'm going to remove the upper eyelid skin with a blepharoplasty. I'm going to remove the lower eyelid skin using a lower eyelid blepharoplasty. And I'm going to do this in a way that leaves the eyes very conservatively enhanced, basically rewinding the changes that have happened as a result of aging. Then I'm going to restore the volume that's affecting her temples, her lower lids, upper lids, as well as the areas around the jawline and mouth, to establish a better contour once all the tissues are put back into place. And as you can see on post-op day 1, she looks pretty rough and pretty beat up, but you can already see the improvement in the positioning of her jawline. You can see that V-shaped jawline starting to really come out, and the overall shape of her face has changed dramatically. Now, when you look at her as she's going through the healing process, there's gradual but significant changes that are happening from point to point along the healing continuum. And once you reach around 2 weeks, 3 weeks after the facial rejuvenation, all of a sudden the light starts to hit at the end of the tunnel, and bam, there you go. Now you're starting to see Lalita coming through. Her rejuvenated, refreshed look, the look that she's familiar with, the look that she expects to see every time she looks at herself in the mirror, is back. So the magic and the secret behind great rejuvenation, as exhibited in Lalita's case, is the combination of addressing facial shape, which is the procedures we've performed: vertical restore, upper eyelid blepharoplasty, lower eyelid blepharoplasty, and restoring facial volume through the fat transfer procedure that we've performed, and addressing skin. So it's laxity, volume, and skin. And in Lalita's case, her skin was rejuvenated and brightened and refreshed using the Karam MD trifecta, which she's been using diligently from before surgery until after surgery. And as you can see how much more rejuvenated and bright and youthful her skin looks as a result of the consistent use of the active ingredients that are part of the trifecta, and why I'm such a bullish person on the trifecta, not just because I personally developed it. It took about 5 years to get it to this, but because of the fact that it's scientifically tested and proven to give the results that you see here. And that's a result of approximately 20 different active ingredients in this 3-step process. And as a result of the consistent and continual use of it, one can expect massive improvements in their skin, which we have seen in Lalita's case, as well as so many of the other facial rejuvenation cases that we've seen. And this is a dramatic, powerful rejuvenation that carries through, makeup and no makeup in social situations. And ultimately, you can see the spirit is much more bright and the confidence has been restored, which at the end of the day is the fundamental principal reason for doing these types of procedures. Looking at her before and afters next to one another, you can see what a dramatic improvement there is in her overall appearance. And this is really, at the end of the day, the core reason why these procedures are performed. But the beauty of the vertical restore and the comprehensiveness of the facial rejuvenation is that when you look at this, you see a natural looking result. You look at somebody who looks like themselves minus the aging process. And in Lalita's case, even though this was a dramatic rejuvenation and she looks significantly younger and better than she did prior to surgery, she does not look like she's had a lot of work done. If you didn't know what her before looked like, you would never guess that she had this dramatic change. And that is a combination of the right techniques, performed the right way, in experienced hands, and that's really the vertical restore difference in my practice. At the end of the day, this is what we want for all of our patients. These results are beautifully replicatable. They're very consistent and reliably achieved. They're done under local anesthesia with IV sedation, which ultimately means less risk and less potential downtime. All right, guys, I hope you enjoyed that tour, that journey through Lalita's case. It was such a pleasure and such a blessing to share that with all of you. I'm so grateful to Lalita for giving us the opportunity to get an insight into the intimate stages of her healing and the final results. Without patients like her, we wouldn't be able to really understand the potential and capabilities of these procedures. And again, thank you, Lalita. Thank you all for your attention. If you haven't already, make sure you subscribe to this channel where we'll be providing content like this in addition to educational information on facial rejuvenation as well as skincare, between 2 to 3 videos every single week. So lots of good stuff here, so make sure you subscribe. Send this information along to friends and family, get them in the know so we can empower through knowledge and make in an environment where people can make good decisions for themselves. That's the goal of this channel. And ultimately, if you liked it, make sure you hit like. And if you have any questions or comments, please address them below. I will do my absolute best to answer any of the questions you have. As that was so much fun. Thank you for your attention. Once again, Dr. Amir Karam.